Welcome, everyone. Welcome, welcome, welcome. So, my name's Jason Wolther, and I'm the case manager at Pain MD. That is our medical clinic in beautiful Coeur d'Alene, Idaho. Who here has visited Coeur d'Alene, Idaho before? Show of hands. Most of us. All right. Excellent. Excellent. Well, we are super, super excited to be back here in this community, sharing the power of stem cell therapy with you folks. So I know you're all here because you're suffering from some chronic pain problem. Where are the folks that are suffering from joint pain, like knees or hips, shoulders? Show of hands. Where are you guys at so I can see you? Almost over half of you, okay? And then who's suffering from back pain? And so the better question here is who's not suffering from back pain? Okay, good. So we've got a lot of really, really wonderful solutions for these pain problems that don't require pain medications. Who's on pain medications? Or should I say who's not? Okay, who's popping pills? Okay, we don't want to do that anymore. That's not good for you and you know it. And so we're going to really share with you the advancements that we're making with stem cell therapy and how people are being treated. Let me clarify. The FDA has approved harvesting and processing amniotic tissue allograft. That's a fancy name for stem cells. Okay? In the amniotic fluid that surrounds a baby during birth, that amniotic fluid is chock full of stem cells. So when a mother is scheduled for a cesarean section birth, the FDA has authorized 5 laboratories in the country. We've partnered with the best laboratory in the country to do this, to harvest this amniotic fluid and process these stem cells. We believe that the healthcare model in this country is completely upside down. It's driven by money and not by results, and who suffers because of that?
We all do. You do.
We do. We do. The power that made the body heals the body. We all have an innate ability to heal ourselves, don't we? Pharmaceutical companies and big drug companies, that's not really what's going to heal you. You have the ability to heal yourself. And what is the catalyst? What is the cell at the cellular structure that's responsible for your healing? A little louder? Stem cells. That's right. That's right. Stem cells. And so that's why this is the future of medicine. And that's why we're on the road sharing this information with you. Okay. So whether you have a cut on your finger, or you have damaged heart tissues that you don't know about, or you've got, your joints are going bad because the cartilage is wearing thin, you have damaged tissue in your body. Anywhere you have damaged tissue, your body sets off these beacons to attract stem cells to come to that area and heal it. They're called cytokines, but it's just a fancy name for a beacon, okay? And so when your body is letting off these beacons when you're injured, stem cells are attracted to that beacon and to that area to heal it. Okay? Well, what's happening is that you don't have as many stem cells as you did when you were a baby, do you? So your body is just breaking down faster than it can regenerate. Okay? So somewhere between the ages of 30, 40, or 50 years old, things start to go south on you, right? Who happened? Who had that happen to him? Yeah. About 40, 50 years old. Well, I turned 40 this year, so I'm on my way. It's just science and nature that's going to happen to us. The number of stem cells that you have in your body as you get older significantly decreases. And the potency of the remaining stem cells that you have in your body significantly decreases. Right? There's evidence of that when you cut your finger when you were 10 years old, it healed almost overnight. You don't remember which finger you even cut. What happens when you cut your finger now? How long does it take for it to heal? Weeks. Exactly. So what we're doing with stem cell therapy is we're reintroducing hundreds of millions of new potent stem cells into your body to allow your own body's regenerative processes to kick back in again. How's that sound? Great. The modern day fountain of youth. Well, very good. Well, you can have some. This is a chart of how time affects the number of stem cells you have in your body. The scale of these blocks aren't that great, but I'll tell you the numbers. When you're a newborn, 1 out of every 10,000 cells in your body is a stem cell. 1 out of 10,000. When you're 80, it's 1 out of every 200 million cells in your body is a stem cell. So you just don't have, your stem cell bank is depleted. Stem cells are what grew you from a baby to an adult. They continue to rebuild tissue during your whole life. That's what they do. And so simply put, we're reintroducing hundreds of millions of brand new stem cells into your body. Again, we use a lab that the FDA is authorized to harvest and produce this tissue allograft. It's called amniotic tissue allograft. We refer to it as stem cell because it's chocked full of stem cells. It has other things in it. It also has growth factors and growth hormones that promote healing. Hyaluronic acid, which is another healing agent. So it's not just stem cell, but it's chocked full of stem cells. Again, we get them from a donating mother during a scheduled C-section. The mother's carefully pre-screened. There's no harm done to the baby. It's a completely ethical treatment. So did you hear what Marion said about not only is her pain getting lowered and her pain scale going down, but she's got more stability and more mobility in her knee. See, as your pain goes down, strength and mobility and stability go up because you have the ability to do more things. Well, what do you think she's doing in life now? The things that she wants to do, a higher quality of life. That's ultimately what this is all about. So, great story. Good news. I got really good news. Here's the same study in comparison. Out of 223 stem cell patient treatments, these are just a simple knee injection into the knee, there were no significant levels of complications, period. None. No heart attacks, no deaths, no embolisms, nothing. Nothing. Zero. And 89% of the stem cell therapy patients experienced greater than 50% improvement, and half of those experienced greater than 75% improvement. Who here knows of someone who's had a failed knee replacement surgery? Anybody know anybody who's had a failed knee? Are they happy campers? No. No. Do you think? Okay, so enough said. That's enough doom and gloom about knee replacement surgeries. So the power that made the body heals the body. I truly believe, and it doesn't matter if you think it's a God-given ability or whatever you believe, your body has the ability to heal itself. You're born that way. No pill or no steroid or no scalpel has the ability to heal you. You can heal your body from within. And what causes healing in our bodies? Stem cells. Stem cells. We're going to talk about this more as we move forward, but as you get older, you don't have as many stem cells in your body anymore, so you're breaking down and not regenerating as fast as you used to when you were younger. So, in plain English, for the purposes of joint pain, amniotic stem cells considerably slow down or stop our bodies from degenerating, while at the same time significantly speeding up our body's regeneration process. So it's just that simple, and that's how you regain your youth and your vitality. That's how you literally reverse the aging clock, by introducing these cells into your body. Does that make sense? Your pain and your suffering that you're living with doesn't just affect you, is the point, right? It affects everybody in your life. It affects your spouse, your kids, your grandkids, everybody. And so ultimately, I hope after this journey and after this education today that you're seeing that there is an alternative treatment to what you have been getting. And that, this is your opportunity, ultimately, to take advantage of some new technology, a new alternative to treating your chronic pain problems, and something that isn't just masking your pain. Okay? So, what I'd like to do now is, by a show of hands, how many people here believe stem cell therapy can help what they came in here for today? Who believes that?
Not quite there yet.
Not quite there yet. That's fine. That's okay. Well, that's all right. If you have more questions that you need answered before you can make an educated decision, we're here to answer them for you. Yes, we are. So let's talk about the investment that this is going to be in your life and what this is going to take for you guys to invest in your health to get your lives back.